Okay, we're live. So Kelsey, you can go ahead and start us off.
Our group chose to do a formal debate on the use of punishment in ABA. I am Kelsey and I will be the moderator and the video editor. I have a bachelor's degree in human development and child services. This is my fourth semester at Ball State. I am currently in RBT working with children with Down syndrome and ASD, and my future goals is a licensure as a behavior analyst to work in a private practice. Vera is the opening stater and the prover. She has a PhD in applied developmental psychology from the University of New Orleans. This is her first semester at Ball State. She has a postdoctoral fellow at an autism clinic, and her future goals is licensure as a psychologist and behavior analyst conducting psychological assessment and behavioral treatment with children with behavioral problems. Whitney is the attacker and closing stater. She has a bachelor's degree in special education from Georgia College and State University. This is her second semester at Ball State. She teaches kindergarten through second grade students with ASD. Her future goals is a licensure to practice as a behavior analyst to provide services with individuals with ASD. Rosie is the opening stater and the prover. She has a bachelor's degree in communication and science disorders from the University of Texas Pan American. This is her second semester at Ball State. She is a speech and language therapist working with children with ASD and other developmental disabilities. Her future goals is a licensure as a behavior analyst. And James is the attacker and closing stater. This is his third semester at Ball State, and he is RBT working in a classroom with students with ASD. His future goals is licensure as a behavior analyst. Our dilemma is that there's current controversy regarding the use of punishment procedures in the field of ABA. While many practicing in the field support the use of punishment if and when it is necessary to reduce severe challenging behaviors, many continue to criticize the use of punishment for being aversive and unethical.
Punishment in ABA is an effective treatment for severe challenging behaviors when implemented ethically. There is common misconception that ABA is punishment-based, and it's very important to dismantle this misconception through education by defining punishment and describing the circumstances in which it is used, the frequency of its use, and how it is used. So first of all, punishment is defined as a consequence following a behavior that reduces the likelihood of that behavior occurring in the future. Punishment can be both positive, which is adding a stimulus to decrease the likelihood of the behavior occurring in the future, or negative, which is removing a stimulus to decrease the likelihood of that behavior occurring in the future. In ABA, often the goal is to reduce challenging behaviors. Another common misunderstanding is that aversive punishment strategies like electric shock and slapping, which were historically used, are still widely endorsed in contemporary ABA. In fact, very few individuals in today's field would support such aversive punishment strategies. More common types of punishment that are used include response blocking, which is a common strategy to address aggressive behavior that involves placing one's body between the client and the peer that he or she is attempting to aggress towards. Another commonly used form of punishment is overcorrection. For example, if a client throws materials because he or she didn't want to complete an assignment, an ABA therapist could have that client repeat the steps over. So response blocking and overcorrection are both examples of commonly used types of punishment in ABA that are less aversive than harsh punishment procedures that were endorsed in the past. Finally, another misunderstanding about the use of punishment in ABA is that it's implemented frequently. In truth, consequence-based interventions based on punishment are used to reduce more severe challenging behaviors only after less invasive strategies focusing on positive reinforcement are used first without success. And again, this would only be used, or punishment would only be used provided that consent was obtained from the clients or the client's caregivers. Thus, punishment is implemented as a last resort. So today my team, Whitney and I, will present the current research supporting the use of punishment in ABA, showing its efficacy in decreasing severe challenging behaviors when other treatment methods have failed.
Thank you, Farah. So punishment-based interventions are amongst the most controversial treatments for challenging behaviors in the applied behavior analysis literature. Dilemma that surrounds it most is the morality of punishment and the effective use of punishment. It is important to remember that punishment is a very broad term, which may be misleading due to the nature of its definition. There are various definitions that have been developed throughout the history of punishment-based interventions to describe punishment. There are also various forms of punishment to consider prior to implementing these aversive procedures. Additionally, if punishment-based interventions are deemed appropriate for select clients, the long-term effects resulting from such aversive procedures are increasingly uncertain. How are these long-term effects from exposure to punishment-based interventions damaging to the individual, at most traumatizing for them? The controversy that surrounds the punishment-based interventions concerns both the efficacy and the ethical dilemma. Despite punishment procedures being around for over 30 years, they continue to be one of the most controversial for challenging behaviors. The controversy that continues to surround these interventions is even greater in ABA literature. Although researchers continue their investigations, there is still a gap in the literature about the lasting effects of punishment. Both the practitioners and researchers alike are still concerned with the morality of punishment and the aversive strategies' usefulness. In a study by Lavigna and Donnellan in '86, they supported the use of reinforcement-based strategies that can effectively change the behavior without the harmful side effects of punishment. One of the core ethical principles in the Professional Code of Ethics of Behavioral Analysts is to do no harm. As behavior analysts, we have the responsibility to provide the most effective treatment to our clients in the least restrictive environment. In addition, punishment-based procedures should always be the last resort, if at all. Furthermore, behavior analysts have a duty to promote the best practice and provide treatment to others served with care and compassion as established in the Professional Code of Ethics for Behavior Analysts as of 2016. Treating others with respect, autonomy, care, and compassion is paramount for any treating healthcare professional, especially the behavior analyst. Aversive strategies as punishment-based interventions may be damaging to the client who is unable to provide informed consent for themselves. I will now pass it over to the opposing side to defend the position on the use of punishment in ABA.
Thank you, Rosie. So one thing that we want to keep in mind is that research indicates that reinforcement is not always effective in the reduction of problem behaviors. For example, Hagopian and colleagues in their 1998 review reviewed 21 cases in which the primary intervention included functional communication training, which is defined as a differential reinforcement of alternative behavior in which an individual is taught an alternative response to obtain the reinforcer that is maintaining the problem behavior. In this review, Hagopian and colleagues found that only 1 out of 10 applications of functional communication training alone were successful at problem behavior reduction when the problem behavior and alternative response resulted in reinforcement. However, 17 out of 31 applications of functional communication training were successful when extinction was used in combination. And finally, 17 out of 17 applications of functional communication training showed success when punishment was used. So these results seem to suggest that interventions with punishment may be more effective than interventions without punishment in decreasing severe problem behaviors, and may even be necessary when the functions of challenging behavior cannot be determined or controlled. For example, one recent study conducted by Hanley, Piazza, Fisher, and Maglieri supports that aforementioned contention. So what these researchers found, first they examined the efficacy of functional communication training with and without punishment for 2 children with severe challenging behaviors, including aggression and self-injury. Further, the researchers used a preference assessment procedure using a switch breast to evaluate each participant's preference for functional communication training only, functional communication training with punishment, or punishment only. If you look at figure 1, you can see that it depicts the study results, which indicated functional communication training with punishment showed more efficacy in decreasing challenging behavior compared to functional communication training alone for both participants. And when we look at figure 2, we see that both participants showed a clear preference for functional communication training with punishment when they were presented with a choice. So these above studies show support for the efficacy of punishment for decreasing severe challenging behaviors that have not shown success with less aversive strategies. Further, punishment is most often employed when the response reinforcer relationship cannot be eliminated. And for challenging behaviors that can be harmful to a client or others, such as self-injurious behavior or aggression, it is ethically important to present treatment alternatives to improve the quality of life for clients. Clients have the right to safe and effective strategies, including the ethical use of punishment, to reduce problem behaviors that are negatively impacting their lives. Finally, research supports that interventions of punishment significantly maintain treatment effects. For example, Ricker and colleagues' analytic review indicated that functional communication training with punishment showed a 90% reduction in 54% of applications and an 80% reduction in 62% of applications. While these reduction percentages are more modest than those previously reported by Hagopian and colleagues, the 90% reduction reported by Rooker and colleagues showed 100% maintenance under schedule thinning, supporting that the use of punishment strategies effectively maintain low rates of problem behavior, even post-treatment. So overall, for severe problem behaviors that have not shown reduction success with reinforcement-based strategies, the data presented support that interventions with punishment are more effective than interventions without punishment in problem behavior reduction and successfully maintain low levels of severe problem behavior. I will now give the argument back over to the con side, and Rosie will present.
So as behavior analysts, our major responsibility is to provide safe and humane treatment to the clients. As previously mentioned, it is paramount to provide treatment to those served with care and compassion as established as a core ethical principle in the Professional Code of Ethics. In the Book of Ethics for Behavior Analysts by Bailey and Birch, they stated that many of the previous ethical principles relate back to this core ethical principle. As behavior analysts, respecting the client's autonomy, working for the benefits, and developing their programs that accord to their dignity without due harm will demonstrate automatic treatment to care and compassion. This value suggests not only that the client will be given choices, but also interpersonal relationships will demonstrate sympathy and concern. Prior research has described punishment as procedures used in applied settings, including aversive stimuli, work and penalty procedures, and the removal of reinforcing events, as in an article by Mattson and Katzen in 81. Additionally, it was redefined by Lerman and Bourdron and by Michael in 93 as an environmental change contingent on behavior that produces a decrease in responding over time. Most recently, as described in the opposing prose side, it's defined by Boated and Hume as a consequence following the behavior that reduces the likelihood of the behavior occurring in the future. Subsequently, they identified the types of punishment, such as the use of positive and negative punishment. However, the history of punishment procedures used to help modify behavior has a very obscure beginning. Today, this is still haunting for the treating behavior analyst and poses a risky procedure to implement. The behavior analyst, as the treating professional, must be clear, vigilant as an obligation to treating clients with respect. As professionals in the field, we are to be observant when proposing assessment and treatment options available for the client's specific needs. With the development of the strict professional code for behavior analysts, the standards imposed have protected both the client and the professional from hazardous and horrific events, such as a historic event, as was the case in the Sunland Training Center in Miami. This historic event demonstrated unlawful, horrific treatments done to the residents in that facility, with the most abrasive treatments imposed. Some of these abrasive treatments included forced public masturbation, beatings with a wooden paddle, forced washing of the mouth with soap, and excessive use of restraints. These acts were a clear violation of ethical and moral principles. Without a doubt abusive. The acts were undignified to clients. The core ethical principles for clients' rights and in the BACB Code of Professional Ethics state as professionals we are obligated to be just, treating others with the utmost respect. This is derived from the Golden Rule and according dignity to clients we serve, as noted, as not all are effectively able to represent themselves. The Code 4.08 from the Professional Code of Ethics states that behavior analysts should recommend reinforcement rather than punishment whenever possible. Cooper Ito in 2007 stated that it is well known that punishment can produce troublesome side effects and that other strategies should almost always be used first. This can potentially eliminate horrific acts, as was the case in the Homeland Miami scandal. Some effects of punishment include escape behaviors and avoidance response and emotional reactions that oppose danger to the individual. The misuse of punishment extends way beyond recent application of behavioral techniques. The use of punishment procedures should be carefully considered and all variables involved carefully evaluated. Such variables may include The use of punishment procedures should be carefully considered and all variables involved carefully evaluated. Such variables may include any genetic factors and medical treatments that may cause challenging behaviors and outbursts. Punishment-based procedures require more staff training and are more time-consuming than those that are reinforcement-based. Code 4.08 subsection D for behavior analysts ensure aversive strategies are to be accompanied by an increased level of training, supervision, and oversight. Behavior analysts should also be available to evaluate the effectiveness of these procedures in a timely manner and modify it accordingly if it's ineffective. The reinforcement procedures should play a central role in any program designed to suppress the behavior. It is key to remember that reinforcement procedures are not just less abrasive, they also require less staff training. They're made more available and implemented accordingly. They're also more timely effective. The reinforcement procedures like extinction and positive reinforcement help with decreasing challenging behaviors. Undesirable side effects also appear less often with reinforcement techniques aimed at reducing undesirable problem behaviors as opposed to punishment techniques. I will now pass it over to the opposing side. And Whitney will continue.
Hi. That current research indicates that the use of punishment is unethical. However, the opposing argument fails to present recent results in literature. The supporting data that they typically present is nearly 30 years old, which in research terms is not considered recent. There's an alteration and a stereotype in the examples that are given of punishment by opposing argument. The argument highlights the removal of essential necessities, such as items that are always needed. The current use of negative punishment does not typically remove necessities. Rather, it involves the removal of a non-essential reinforcer, such as a preferred item or activity when the problem behavior is presented. More recent research shows, according to Hanley et al. And Rooker et al., many treatments based on function often are significantly decreasing challenging behaviors without utilizing punishment components. So two extensive analyses reviewing 25 to 58 applications as referred to as FCT. The study implemented FCT both with and without punishment, and then provides the punishments to enhance the treatment efficacy. According to the Hagopian and Roker articles, the FCT was punished to be more effective. Code 4.08C states that behavior analysts should consider punishment-based treatments if the nature of the problem behavior is that of severity or if it is dangerous. If the research shows that it is dangerous and that the punishment component is more successful, the ethical code by not providing the student with the most and best treatment possible to extinguish the dangerous behaviors. I'll now turn it over to James.
The article by Hanley, Piazza, Fisher, and McGlary 2015 used in the pro argument addresses that both patients prefer the functional communication training with punishment phase over the other phases that did not use punishment. The type of punishment procedures that was used over the other phases, the type of punishment procedures that were used, physical restraints, may have functioned as a form of attention or a sensory experience for the subjects. In the study, the FCT plus punishment intervention phase 3 involved holding the client's hands to the side for 30 seconds or holding the child's arms down with one arm while placing the other arm around the child's eyes. Staying consistent with phase 1 and 2, which withheld attention with the occurrence of problem behavior, phase 3 should have withheld attention or used a different punishing procedure. Furthermore, Hanley et al. Suggests that reinforcement per response was higher in phase 3 than phase 1 and 2. To explain this result, it may be that both the target behavior and the replacement behavior was successful at contacting adult attention. If the subject engaged in target behavior, steps should have been taken to prevent the subject from accessing adult attention. Lastly, the low rate of reinforcement per response in the FCT trial may have contributed to conditions that failed to enable a functional relationship between an alternative behavior and attention, while the extinction procedure may not have been strong enough to disable the functional relationship between the target behavior and attention. It is possible that the target behavior was more functional in contacting adult attention than the replacement behavior. A PREMAC principle could have been implemented to make the target behavior less valuable and an alternative behavior more functional. This would have prevented the subject from receiving direct contact with adult attention. Additionally, a denser schedule of reinforcement should have been considered. In the study by Hagopian and colleagues in 1998, all the patients in this study were diagnosed with mental retardation, and most of the sessions were conducted in a padded treatment room. Therefore, the study only represents a clinically referred sample. It is difficult to see how these results would generalize to patients with autism, those treated outside the clinical setting, and those with less severe problem behavior. Additionally, the study suggests that treating behaviors that are severe can only be done in a controlled clinical setting. Given the restrictions of punishment-based interventions, what does the long-term prognosis, generalization, and maintenance of skills look like for these subjects? Unfortunately, there's no answer to these questions because there's a large gap in literature addressing these factors related to punishment-based interventions. Therefore, until research can address these concerns, punishment-based interventions can put clients at risk of unknown consequences. The Hagopian et al. Article used in the pro argument demonstrates that an intervention can fail when reinforcers are not effective. This study does not describe preference assessments having been conducted before the study and does not discuss the schedule of reinforcement used. In the FCT without extinction trial, the children received the same reinforcement regardless of their behavior. The lack of differential consequences for problem behavior and appropriate communication during the reinforcement interval may have interfered with the child contacting sufficient reinforcement for communication to establish a stronger functional relationship. Consequently, this may have been the cause for the 17.4% increase in the rate of problem behavior observed with FCT without extinction. This suggests that the reinforcer was not effective and the replacement behavior was not sufficient in contacting reinforcement. In this case, additional preference assessments should have been conducted. Bailey and Birch 2016 state, as a general rule, if a desired behavior is not occurring, it is probably because there is no reinforcement to sustain it. The last issue that I want to address with this study is that treatment effects were altered by demand fading and delay to reinforcement fading. In the Hagopian et al. 1998 article, 13 of the 17 applications of FCT plus punishment were faded and consequently altered the overall treatment effects of FCT plus punishment. However, the 4 applications in which the punishment was not faded, there was no disruption in the effectiveness of FCT plus punishment treatment. Although fading effects were minimal, this may suggest that fading punishment-based interventions may be troublesome. Additionally, questions must be considered such as how difficult would it be to train someone, such as a parent, on fading procedures, and what is the success rate of fading punishment-based interventions? As for now, no research has attempted to answer this question. Next, I will pass it back over to Whitney for the pro-argument closing statement.
James. So, in conclusion, behavior analysts should strive to provide evidence-based and ethical treatments to clients that produce meaning. So, less intrusive treatments that focus on positive reinforcement should be implemented first. But when these have failed, we turn to the Ethical Code 2.09 Section A. Ethical Code 2.09 Section A regarding intervention efficacy states that clients have a right to effective treatment when implementing punishment when less intrusive treatment options have failed. So the Hagopian and Hanley and Roker articles, they all indicate that treatment focusing on positive reinforcement are not always successful at reducing more severe behaviors. And as a result, it is often necessary to add the punishment component to a treatment plan to produce significant decreases in severe challenging behaviors. Also, behavior analysts, we are always trying to outweigh the cost versus benefits of using versus not using punishment in a situation in which severe challenging behaviors may be detrimental to the optimal quality of life for our client. If there is imminent danger to the client to harm themselves or others severely, the behavior analyst should see the cost as being too high of a risk to not use the punishment component to decrease the behaviors in a timely manner. If we look at Ethical Codes 4.02 and 4.08, we see some important considerations for implementing punishment. So the Ethical Code 4.02 states that must have consent of the client or caregiver. And so we must get consent before implementing these punishment procedures. We must also involve them in the planning of their behavior modification. So we should also make sure to use it as a last resort when the least on reinforcement have failed, and that's according to the Ethical Code 4.08 Section A. According to Ethical Code 4.08 Section B, while implementing punishment procedures, we should combine reinforcement procedures for when we have an alternative replacement behavior in that alternative replacement behavior. According to the Ethical Code 4.08 Section C, we must analyze the severity of the behavior, and if severe enough, we should implement punishment procedures first. So we must also make sure to provide proper training to those who are implementing the punishment, and we must supervise and oversee the implementation of the punishment procedures according to Ethical Code 4.08 Section D. Ethical principles that we should also keep in mind when using punishment is make sure we're benefiting others, make sure we're not doing harm, we're offering the dignity, and we're treating others with care and compassion. We must take these into consideration when using and choosing the type of punishment as well. So we do the planning, and we need to make sure that the behavior is severe enough to warrant the punishment, so we are benefiting the client and not causing harm. Turn it back to James to have the closing statement for the opposing argument.
Thank you. The history of punishment and behavior modification has a very dark beginning, one that has impacted behavior analysis today. Therefore, using treatment involving punishment is very risky. How can we be sure that our redefined definition of punishment in today's standards are better than those used in the past? The book Ethics for Behavior Analysts, 3rd edition, by Bailey and Birch, 2016, describes the horrific conditions at the Sunland Training Center in Miami. Some of the treatment programs consisted of forced public masturbation, forced public homosexual acts, forced washing of the mouth with soap, beatings with a wooden paddle, and excessive use of restraints. The book describes how these conditions naturally worsened as poor training and the use of punishment set a trend for more aversive interventions to follow. Today's strict ethical code assists behavior analysts as they navigate ethical issues in hopes of providing the best care possible. Behavior analysts have an obligation to treat clients with dignity, which includes giving them a platform to represent themselves and giving clients a preference regarding treatment. Behavior analysts are also responsible for being just in treating clients with care and compassion. Behavior analysts must always be aware of the potential risks associated with implementing any intervention or procedures. Since there are big gaps in the research on the generalization and maintenance effects of punishing procedures, it is difficult to suggest that this is the best way to go about treatment, even as a last resort. Additionally, there are potential long-term risks that must be considered when using punishment that cannot be said for when using reinforcement-based interventions. To review, arguments against punishment include: first, punishment-based interventions are more time-consuming and involve more staff training and availability than interventions that use reinforcement. For the treatment to be considered ethical by ABA standards, only trained practitioners and caregivers may deliver the punishment. Therefore, it may be difficult to keep trained staff on at all times during an intervention that involves punishment, which can skew the results and deem the intervention unethical. According to Compliance Code 4.08d, we must make sure that aversive procedures are accompanied by an increased level of training, supervision, and oversight. The second consideration, treatments can only be performed with intensity and control if the client is living in a residential setting where staff can monitor the client 24 hours a day. Compliance Code 4.06 states that behavior analysts describe to the client the environmental conditions that are necessary for the behavior change program to be effective. According to methods described by Hagopian et al. 1998, the intervention occurred in padded treatment rooms during 10-minute sessions for 8 to 12 sessions per day for 5 days a week. Furthermore, home-based treatment greatly restricts the possibility of implementing an effective punishment intervention because of the intensity of monitoring and supervision needed to implement a punishment-based intervention effectively. Next is the third consideration. Punishment interventions are aggressive and often require multiple trials and baseline measurements, and this violates the core ethical principle, do no harm. Next, the fourth consideration is multiple trials can cause more harm to clients with few short-term benefits, which violates the Ethical Compliance Code 2.09a, stating that effective treatment procedures should demonstrate both long-term and short-term benefits to clients. An article by Lerman and Fondren in 2002 states that interventions based on punishment can be effective. However, there are unpredictable side effects. Also, it is difficult to generalize results from punishing interventions due to small sample size, and the sample typically represents clients in a clinical setting. The fifth consideration is the importance of having an effective reinforcer, or else the intervention could fail. Therefore, proper preference assessments must be done to make sure that reinforcers are truly reinforcing. Identifying appropriate reinforcers can prevent the use of punishing interventions. Sixth, as discussed earlier, there are gaps in the literature on the long-term effects of punishment-based interventions. However, some of the long-term effects of punishment-based interventions include increases in aggression, escape behaviors, and emotional reactions. Lerman and Fordra in 2002 mentioned that punishment-based interventions are unnecessary since we have functional analysis and treatment and plenty of research on establishing operations, extinction, and reinforcement efficacy. Compliance Code 4.05 states that behavior analysts describe in writing the objectives of the behavior change program to the clients before attempting to implement the program. To the extent possible, a risk-benefit analysis should be conducted on the procedures to be implemented to reach the objective. Using punishment-based interventions violates the code because of the unknown risks that may be irreversible and life-altering to the client. Therefore, too many gaps exist to justify using punishment-based interventions. The last consideration when using punishment is that of consent, such as how susceptible are the clients to being manipulated, and are they competent to make decisions regarding the treatment? According to Compliance Code 4.09, we must provide the clients with freedom of choice. Also, Compliance Code 4.02 states that behavior analysts involve the client in the planning of and consent for behavior change programs. Next, next Kelsey will present the conclusions.
In conclusion, punishment will likely continue to be used in ABA, and research on punishment currently supports its efficiency. There are some important considerations, however. The first is the use interventions focused on positive reinforcement. If and when punishment is employed, always get consent and adhere to the ethics and principles of the Ethical Compliance Code for behavior analysts. Thank you guys for watching, and we hope you enjoyed.